Okay, so my last video, I couldn't really figure out how to get the time to extend really past 10 minutes, so I'm going to begin with reading the last statement from the first speech and then mend it all together and do the conclusion. So this should be about 3 minutes. Sorry about that, guys, but here we go. Um, so we can see that the argument for affordability is foiled by the taxes that people within public healthcare systems are subjected to. And we can also see that the so-called working models of universal healthcare systems do not really offer the same level of care or the same level of accessibility as is the case in the United States. Both forms of reasoning then have holes within them because there's no specific listing of how these government-controlled services provide a more cost-effective option for healthcare than a privatized system. In conclusion, the affirmative does do a good job of listing facts about those Americans that are uninsured, and he has also correctly listed 4 countries that currently operate using public healthcare systems. But his 2 main points for healthcare reform, affordability, and also the working models in other nations, tend to fall flat. And my opponent does not list enough information in regards to the effectiveness of all aspects of the universal healthcare systems in these working models that he lists. These support structures to his affirmative argument do not work well because they're highly generalized and they offer no direct reasons as to why the privatized system of healthcare does not work effectively. As I have shown with evidence, there is a large amount of taxes that are placed as a burden onto families that erases the benefits of universal healthcare coverage in the terms of affordability. Some of the standard practices that are covered in the United States are not covered or provided with other universal healthcare systems and their insurers. Also, we can see through evidence that the lack of competition for healthcare industry businesses that a universal healthcare system uses can really stifle the amount of access individuals have to be able to to be able to seek the right kind of treatment and the right kind of care in an effective manner. The working models that my opponent lists are not as free as are advertised, and there are many other public programs that suffer from cuts as a result of public healthcare systems and keeping them in place with rising costs. The United States would also, in my opinion, be better off to maintain its current system of privatized healthcare because of low waiting times, high access to care, leading practitioners, leading innovation in medicine, and above all else, the freedom to choose which provider and which hospital to receive treatment from. Thanks.